Here, I'm going to discuss a few questions already came in the previous NCLEX board. Let me explain with explanation. The first question is here. Which nursing intervention is the most appropriate for a client with multiple myeloma? So multiple myeloma, also known as plasma cell myeloma, and it is the cancer of plasma cell and a type of white blood cell. Plasma cell is the type of white blood cell. And this plasma cell normally produce the antibodies. So often, no symptoms are notified at the beginning of multiple myeloma. As it processes, patient complain bone pain, anemia, kidney dysfunction, and infection may occur. If patient has a multiple myeloma, the complication may include amyloidosis. The cause of multiple myeloma is unknown, but there are some risk factors like obesity, radiation exposure, positive family history, or certain chemicals. In this picture, we can see the bone marrow, and bone marrow can produce red blood cell, platelet, and white blood cell. White blood cell can produce plasma cell, or we could say B cell, B lymphocyte. When antigen attack, and body can produce antibody, and this antibody basically plasma cell. So when the patient has a cancer cell, deformed cell, damaged white blood cell, so patient immunity go down because plasma cell are defective, neoplastic. So in this question, what are the nursing interventions the most appropriate for the client who have multiple myeloma? Like monitor the respiratory status, balancing rest and activities, restrict the fluid intake, and preventing the bone injuries. So as I told you, the patient most of the times complain of bone pains, patient develop anemia, kidney dysfunction, and infection are more common. Patient do not need to restrict the fluid intake or had patient nothing related to rest and activities. We could monitor the respiratory status, but if patient have multiple myeloma, means cancer of the plasma cell, and plasma cell can produce the bone marrow, it's important to preventing the bone injuries. So let me read what is myeloma. It is the osteolytic neoplastic. Osteo means bone cell. Neoplasm means cancer, consisting the protrusion of cell, typically the bone marrow. So in this picture, you can see this is the bones, this is bone marrow. So multiple myeloma is a cancer arising from abnormal growth of plasma cell. The common sign symptom, it is increase the calcium level and renal or kidney abnormalities, anemia, and bone involvement. Right? So easy way to remember: BRAB. A for anemia, B for bone involvement, R for renal or kidney abnormalities, and C for increase the calcium level in the blood. Other signs and symptoms: repeated infection, weight loss, weakness or numbness in legs. Here we say preventing bone injuries. And what is the rationale? When caring for a client with multiple myeloma, the nurse should focus on relieve the bone pain, preventing the bone injuries, and prevent the infection, and maintaining the hydration, monitoring respiratory status, or balancing rest and activity are appropriate intervention for any client. But for multiple myeloma, most appropriate or most accurate bone injuries to prevent such complication like pyelonephritis. Because of disease process, sooner or later, if untreated, patient kidney get involved. Kidney dysfunction is more common, and patient infection is common because it is the plasma cell defect, plasma cell related to antibody, and easily get infected. Pyelonephritis means kidney or pelvis infected, inflammation, renal calculi. The nurse should keep the client well hydrated, and also no need to restrict the fluid intake. Next question. An adult client with a Hodgkin disease. So Hodgkin disease, whose body weight is 143 pounds, is to receive the vinblastine or vincristine 25 microgram per kg intravenously. What are the correct dose in microgram that the client should receive? Record your answer with a phone number. So Hodgkin lymphoma, right? So Hodgkin lymphoma, it is the lymph node disease, right? Hodgkin disease or lymph node get involved. So the question is not Hodgkin disease, but let me explain a little bit. I said Hodgkin lymphoma or Hodgkin disease is a type of lymphoma. What is lymphoma? Lymphoma is a group of blood malignancy that develop from lymphocyte, or and lymphocyte is a one type of white blood cell. So as I told you, Hodgkin disease or Hodgkin lymphoma is a type of lymphoma in which the cancer is origin from a specific type of white blood cell called lymphocyte. So the patient who have a Hodgkin lymphoma, most common symptom may include fever, night sweat, or weight loss. Often there will be no non-painful enlarged lymph node in the neck or enlarged lymph node under the arm or groin. And those affected may feel tired or be itchy. Whatever it is in this question, your patient body weight is 143 pound. So keep in mind, in any kind of mathematical question, we always convert the pound to kg. And we know 1 kilogram or 1 kg equal to 2.2 pound. So conversion is the first steps to solve any mathematical problem. So when you see the question in pound, we always convert to kilogram. 143 pound, if you want to convert in kilogram, 143 supposed to divide it by 2.2, right? And what you will get, like example, you get 45. This 45 will be multiplied by 25, because we know in the question they said 25 microgram per kg IV. So this 45 will be multiplied by 25, and that would be the answer. So like I said, 45 multiply this 25, right? And it would be like 1,625 should be the total amount. So what are the total dose in microgram that client should receive? Record in a full number. So let me go their answer. They said rationale. The first, convert the client body weight from pound to kilogram. We know 1 pound equal to 2.2. No, we know the 1 kg equal to 2.2 pound. So this 143 supposed to divided by 2.2 kg, and it would be 65 kg. Next, multiply the weight in kilogram by the number of microgram desired per kilogram, because it is already in the question 25 microgram per kg. So it is multiplied, total 1,625. Next here, a client receiving chemotherapy, right? So chemotherapy for breast cancer. Which assessment finding indicate a chemotherapy induced complication? So chemotherapy, basically the treatment of disease by the use of chemical substance, especially the treatment of cancer by cytotoxic or other chemotherapeutic agents. So when patient take that chemo, they develop some sign and symptom what is related to chemotherapy doses, right? So chemotherapy, particularly a drug treatment that used to powerful chemical to kill the first growing cell in the patient. And chemotherapy is most often used to treat cancer. And since the cancer cell grow and multiply much more quickly than the most cell in the body, Many different chemotherapy drugs are available, and chemotherapy drugs can be used alone or in combination of treat a wide variety of cancer. So chemotherapy have some side effect, as I told you, and most common side effect, patient feel fatigue or tired, hair loss or alopecia, easily bruising or bleeding, infection, and also patient develop anemias, means low red blood cell count, patient develop nausea and vomiting. Sometimes appetite change, patient develop constipation or diarrhea, mouth, tongue, or throat problem, such as the sore throat or pain with swallowing. Right? But whatever the side effect, we have to choose the answer from following option. So number one, say urine output 400 ml in 8 hours. So what are the normal urine output per day? If you know this, it would be easy to find out. Right? So usually I said normal urine output, usually it is 3 liters each day. So excessive urine output, or if it is too low, or if it is too more or excessive, that if your production is more than 3 liter each day, it is excessive. If it is less than 1 liter, it is scanty or no urine at all. Both are abnormal, right? So in general, it is considered the normal to urine output around 2 liter or 3 liter every day. But it will vary based your gender, your age, how much you intake, everything related. But whatever, 408 hours, nothing abnormal. Now, number two, serum potassium level 2.6. Definitely it is abnormal. What is the normal serum potassium level? It is 3.5 to 5. So it is abnormal. And this potassium or hypokalemia lead to develop cardiac dysrhythmia, and cardiac dysrhythmia lead to develop cardiac arrest, and patient will die. So this is the most priorities, number two. Number three, say blood pressure is 120/60, it was. But after chemotherapy, it is 130 to 72 millimeter of mercury. And 130/72, nothing abnormal. And number four, sodium level 142 ml, milliequivalent per liter. This 142 in between the normal range. Normal range is 135 to 145. So it is nothing abnormal. So number two is the answer of choice. And let me read their explanation. Rationale: chemotherapy commonly causes the nausea and vomiting, which may lead to the fluid and electrolyte imbalance. The sign of fluid loss include serum potassium level below 3.5 milliequivalent per liter. Normal it is 3.5 to 5. decrease urine output less than 40 ml per hour. Some books say 32 ml per hour. So how much it would be 8 hours? 40 times or multiply 8 hours. It is almost very close to 400, right? The sign of fluid loss include serum potassium level, they said low, and abnormal low blood pressure, but it is normal blood pressure almost. Urine output 400 ml 8 hours, or serum potassium level 142, sodium level. Sodium level 142 is normal. Blood pressure 120 over 64 to 130 over 72 are not abnormal findings, except the potassium level. What should next question, what should make a client older than age 50 do help ensure early identification of prostate cancer, right? So prostate cancer or prostatic carcinoma, it is after certain age. In case of man, it is need to scan. So early stage of prostate cancer may not that cause any sign and symptom, right? So we need to figure it out. We need to regular checkup. But the symptom commonly noted during the advanced stage. Prostate cancer, if you identify at the beginning, it will be 100% curable. But if in advanced stage, it is easy to metastasize to the bones and causes the death, right? Usually the patient who have the prostate cancer, they complain of difficulty of urination, frequency of urination, decrease the force of urination, or difficulty starting or stopping urine stream, sometimes blood in semen, or pain or discomfort in the pelvic area, or bony pain, most common. So it is good to prevent. How we can prevent? Let me tell, but find it out the answer. Have a digital rectal exam and prostate specific antigen, shortly called PSA test. Answer is 1, and this because digital or rectal exam, doctor usually do this, and doctor can feel prostate is bigger or enlarged or not. And PSA is the marker we call cardiac marker for prostate. So if it is not normal, if it is too high, it indicates patient has a carcinoma. Have a transrectal ultrasound every 5 years. Nothing, it is not related to the prostate cancer. Or perform monthly testicular self-exam. Testicular exam for the testis cancer. Have a complete CBC or blood urea nitrogen and creatinine. So BUN and creatinine for the kidney function test. Complete blood count or CBC, we can find it out for inflammation, or we can find it out any kind of infection. But PSA are specific for prostate. So the incidence of prostate cancer increase after the age of 50. Digital rectal examination, which identify enlargement of or irregularities of the prostate. The PSA test, a tumor marker, PSA is a tumor marker for prostate cancer. After effective diagnostic measurement, they should be done yearly. The testicular self-examination would not identify the change in the prostate glands because of its location in the body, because of location. A transrectal ultrasound, CBC, or BUN, or creatinine level are usually done after diagnosis to identify the extent of disease and potential metastasis. If I ask you how we prevent the prostatic cancer, keep in mind, there are no definitive measurement to prevent the prostate cancer. The risks can be reduced by take some steps, or certain precursor can prevent it, like eat a healthy diet rich in fruits and vegetables. And you should cut down of fatty food or have a regular exercise can help. Also remain physically active, maintain a recommended weight, also avoid the smoking and alcohol. It can help. A few minutes after beginning a blood transfusion, a nurse note that a client has a chill, dyspnea, and urticaria. Patient has a fever or chill, shortness of breath, and urticaria. Urticaria, because of any kind of anaphylactic reaction or allergic reaction, patient has an urticaria, it's common. The nurse report this is to the physician. The nurse should report this to the physician immediately because the client probably is experienced with problem. What problem? If after the blood transfusion, if your patient have a reaction like chills, dyspnea, and urticaria, there are 4 options. Which one is the most appropriate? Keep the note. Blood transfusion is a procedure in which a patient intravenously receives blood from a healthy donor, usually during the surgical operation or any medical condition like anemia. But blood transfusion, after you transmit as a healthcare provider, we will be with the patient for a few times, or we will be with patient, right, to see the blood transfusion reaction. What are the common blood transfusion reaction? Maybe patient develop hemolytic or hemolytic reaction. If patient has a hemolytic reaction, patient have a develop chill, fever, or tachycardia. If you check the blood pressure will be go down and heart rate will be go up. We immediately stop the blood transfusion and notify healthcare provider. Or some patient have a very febrile, or patient has a headache, tachycardia, and tachypnea, and febrile, means body temperatures raise up. Or patient come with allergic reaction. When patient has allergic reaction, we can see the facial flushing, or patient has a skin rash, hives, or patient develop urticaria. So whatever any kind of reaction occur, we call blood transfusion reaction, we always stop the blood transfusion and we notify to the healthcare provider. There are 4 options. The question call asks if patient has shortness of breath or dyspnea, chill, or urticaria, what is the reason? Hemolytic reaction to mismatched blood. If it is hemolytic reaction, patient also causes fever, but this question does not talk about the fever, does not talk about the tachycardia, does not talk about blood pressure, because hemolytic reaction, blood pressure go down and respiratory rate go up. Number 2, so number 1 is not answer. Number 2, hemolytic reaction to RH incompatibilities. Nothing talk about the hemolytic reaction. Number 3, hemolytic allergic reaction, because this patient has a shortness of breath and urticaria. This support it is allergic, and also patient develop rash, hives, or facial flushing. Number 4, hemolytic reaction causes by bacterial contamination. But this question does not talk about the patient have a high raise of fever or body temperature, right? So it is important. And now next question here. Let me read their explanation. Hemolytic allergic reaction are fairly common and may cause chills, fever, urticaria, tachycardia, dyspnea, chest pain, hypotension, and also other sign of anaphylaxia in the few minutes after blood transfusion begin in case of hemolytic. But in this question does not mention about the fever, does not mention about the tachycardia. So although very uncommon, hemolytic reaction to mismatched blood can occur, triggering a more severe reaction, possibly leading to disseminated intravascular coagulation, internal bleeding occur, then patient goes shock and die. A hemolytic reaction to RH incompatibility blood is less severe and occurs several days to 2 weeks after transfusion. So that this question is a few minutes after beginning a blood transfusion, immediate reaction. Bacterial contamination of donor blood cause a high fever, but this question does not mention high fever. Also, nausea, vomiting, diarrhea, nothing mentioned in this question, or abdominal cramp, or possible shock. So next question. A nurse caring for a client who receiving fentanyl transdermal system. So fentanyl, it is the medication we use to help release of severe ongoing pain, like such as due to the cancer pain, right? So now question for a pain management, which applying a new system, the nurse include. Number one, press the system in place 30 to 60 seconds. It is too long, less than this, not 30 to 60 seconds. Yet choose a site lower torso. It is not the site for transdermal patch. Also, shape the application site before use. We basically trimming, clipping, not shape. And apply the system immediately after remove from a package. So number 3 is not answer because it should be trim or clip. Torso is not a good site, and also 30 to 60 seconds too big. It is less than 30 seconds. Number 4, immediately it should be the answer. Why it is answer? Let me read their rationale. The fentanyl transdermal system, as I told you, the pain medication should be applied immediately after remove from the sealed package. The nurse should press the system firmly in place with the palm for 10 to 20 seconds, not 30 to 60 seconds. To make sure the contact is complete, especially around the edge. The system should be applied to non-irritated and irradiated skin on the flat surface of the upper torso. When reapplying a new system, the nurse should choose a different site. Here at the application site should be applied before application. The nurse should clean the site with clear water, with soap, with well, or lotion, alcohol, or other agents that might irritable to the skin. Or after its characteristics should not be used. The skin should be dry completely before application.